Does this have translation abilities, as in someone speaks in Cantonese and then it could be translated into English?
That's actually a great question, referring to what you were saying before with wellness.
Or
Absolutely.
English into Spanish?
English into Spanish,
or,
yeah. Not currently. That is also a feature request I have heard before. In fact, it's really interesting enough. Puerto Rico has been very active of pursuing EHR technology. So I've been talking to a lot of people over there, and one of their concerns is multilingual practices. So that is something that's coming. It might quickly be done by a third-party edition first, but it was as the application develops, we would like to put that in there.
Is it okay if I ask these questions as we're going?
Sure thing. The way I look at this is that this is a great opportunity for us to have a real conversation right here. I hope that we'll all be able to talk on the phone and through webinar formats moving forward. But hey, we're all here. It's a lovely Sunday afternoon. Let's definitely address what you want to talk about. Now, and so again, this actually also brings me to kind of a side point. Whenever you see something that is not currently in the application that you think would make it more successful for you in your practice, we want to hear about that. There's always a request a feature button in the top right-hand corner. When you click on that button, it'll send us an email to support with high priority on it. The fact that we're a web-based model, allows us to actually upgrade the product much quicker than anyone else out there. We do upgrades about every 2 weeks, if not sooner. This is significantly more frequent than anyone else. And the reason why, again, is because rather than having you download version 2.0, version 3.0, version 6.0, we merely add the functionality on our end. You log in the next morning, you're going to see that. So we would really appreciate anything you see in the application that you'd like as a feature request. Good question.
Okay. So I'm just coming from like an AOM culture of need. And so if an acupuncture practitioner or practice wanted to have a certain set of descriptors for taking pulse or tongue put in, would that be possible?
Now, are you referring to just information put in the notes, or maybe like an image or a specific form?
Click on information like, tighten wiry pulse, find it, click on.
Right, okay. Now that is...
Deep and soggy. I mean, there's a certain specific language
things we write
that we write down
Absolutely.
all the time, and so...
We build that list for ourselves.
Absolutely, that is specifically exactly how the template is supposed to.
Unless we hire an acupuncturist to build it into a system that we already have
Absolutely.
based on
But
that.
if you
But the
chose a
acupuncturists would have to use the same terminology
Right,
that you
we
use.
could use our own terminology.
Absolutely.
Okay.
So, really quickly, we're taking a look at this back strain template right here. You'll notice it says lumbar strain, trapezius strain, everything like that. This is preloaded in there to get you started, give you an idea of how it works. If it works well for you the way it is, go ahead and use it. We're actually adding a ton more templates very soon. But really, we want you to edit this. We want you to go in there, maybe make your own, or at least edit it, and then share that template with your colleagues so that you can all be on the same page, or just have your own. And the way that would work, and this is something that would just take a few minutes of your time at the end of the day, but we would want to give you the training on how to do, is, for instance, I can just delete this and say,
spleen chi deficiency.
sure. You're definitely going to...
Tight, thready pulse.
Sure, I'm just kind of making stuff up here because, again, I'm not a provider, but you get the idea. Now we have then changed that information. I click on there, it goes right into the chart, and this is moving forward, always available for you. So
if you use a certain phrase a number of times, can you save it into your list of options?
absolutely,
Okay,
absolutely,
And
definitely.
so I assume that this is like robust enough to take like 1,000 different individual herbal form.
Oh yeah, definitely. We have
herbs
some
and so you can
templates
click
that are
on-
huge.
okay.
Absolutely, we've got some
Got
templates
my
that are huge.
attention.
Okay. And this is the kind of thing, probably the customization of the templates is where people really want to get the most walkthrough on. They want someone to walk you through. During our live demonstrations, you are connected through your screen share. You actually see our screens over the phone as well with our support team. And if you say, hey, Roman, for instance, I want to learn how to make a template for this type of visit, we will sit there, walk you through the process, teach you how to do it, and that way you have that support. So again, this is something that will take just a brief period of time to customize once, but moving forward, information is going to be very specific to how you want to go. So again, we've kind of customized this template. We've put the information into the different sections that we want. If you want to diagnose something, it's a click of a button. If you want to send a medication, same thing. Both of which are captured in your history lists. And then at the very end, of course, you can either just save the note to work on later, maybe on Monday, or you can sign it, making it a legal document. Now, of course, making it a legal document does mean it is no longer editable, but we understand mistakes happen, so you do have the option, for instance, to add an addendum saying, this should be this. So this is legitimately a signed chart note. Electronically, you did sign it. It's a legal document. You can then export it. You can then save it, anything you can think of. Now, you can also print the plan section, send a follow-up message to a colleague, but someone did, I think Pam, you mentioned billing. This is where billing would come in. With Practice Fusion, you're able to create a coded super bill. Now, we leave billing very open because we are an EHR with practice management, but we're not specifically a billing company. So we want to make sure that you're not stuck into one way of doing things. I mean, everyone does billing differently. There's the option of in-house or off-site billing. Do you have the resources to do billing in-house, to do the follow-ups? That's the significant one. Scott, do you have a question?
I'd just like to jump in here. Sean Doherty is an ACTCM alum who's using Practice Fusion, and he's using Office Ally as billing, which is a free billing service, but uses Practice Fusion on the patient record side because it's more robust and easier workflow.
Fantastic.
So I just wanted to toss that in there.
And that is a fantastic point because while we do actually have integrated partners, companies we work with, for instance, there's an in-house billing application fully integrated into the system, which allows you to do billing in-house, keep control of the process yourself, send verification checks, send to clearinghouses, all of that. And because it's integrated into the Practice Fusion program, the way it works is that you really just click a button from the chart, all the codes, demographic information automatically populates into your billing application. Now that's the integrated one, but of course, we do leave it open to use, for instance, Office Ally, anything you can think of. If you really like the program you're using, despite whether or not we're working with them on a company level, you can still keep your relationship with that biller. And realistically, the fact that you're creating these coded super bills is going to make it easier to use the billing software you're using today, because this is all electronic, can be easily transferred from one system to another, even copied and pasted. So again, this isn't written super bills, these are electronic, it's going to help anything you do. Now, if the issue with billing is doing the follow-ups, we do have billing service partners. These are billing companies that will do the billing for you, and you don't really have to worry about it. You just send them a super bill, they take care of the rest. The major advantage, of course, of signing up with one of them is the fact that you then have a team of follow-ups, because that's the hardest part. You sent it in once, it didn't get taken care of. When are you going to have the time to follow up with that bill, send it again and again and again? Our billing service partners will take care of that for you. So we have some solutions there. It's going to be a decision on your part to see what resources you have, but we can absolutely talk about how billing will work with Practice Fusion for your particular practice. All right, so this is the billing aspect of side of things, the charting. Some of the other features in here, of course, though, that will be very important are just communication. So emails tend not to be HIPAA compliant. Sending personal medical information across the email, it does violate some HIPAA mandates. So we've implemented a secure messaging module. Right here is basically just a list of notes, a list of messages I've sent to my colleagues in the practice. But again, you can jump straight to the patient's chart from the schedule, from the message itself, because it's all interconnected. Now, again, with our web-based model, this information is accessed from anywhere. So this is just one way that you are able to communicate securely. With our chart sharing feature, you're actually able to send complete chart information to any specialist, whether or not they're using Practice Fusion. So this is actually a huge functionality. This is part of what the government wants with HIT, Health Information Technology. So with our chart sharing feature, again, you can send complete medical information securely to someone who's not even using Practice Fusion. And this will be a secure connection, completely HIPAA compliant.